always had an interest in pain. All the way through my anesthetic training, it was always something that intrigued me. But I always thought it was too difficult as well, something that I perhaps didn't have the skill for. And then I came to an Australian Pain Society meeting, and I met my old mentor, Dr. David Jones, again, and we got talking about pain. And he was the one who gave me the gentle nudge, which made me make the decision in the end to actually apply for a position as a pain fellow. But I guess I'd done research in labor pain, I'd done research in shoulder pain. And so all the way through my anesthetic training, it was, I guess, something I'd always wanted to know why people suffer and what I could do to help.
My eyes opened up about pain medicine from being, from taking a wonderful history, understanding the science and biology of it, and then also understanding that, there was a lot more behind it. There was a lot of mental health issues, drug and alcohol issues with patients, and, part social worker, part physiotherapist. It was a little bit of everything. It was sort of a specialty which took you away from theatre. And as a surgeon, every once in a while it's good to have a break.
So as an anaesthetist, I always had an interest in managing pain, and I guess as I became more senior as an anaesthetist, I realised the challenges associated with good pain management, and that it was more than just medication or more than just an operation offered by a surgeon. And so I guess it came with sort of maturity and experience associated with my primary fellowship.
My main interest was I enjoyed looking at very complex situations. I enjoyed neuroscience, which is part of my educational background. And so I think it was something I found challenging in my previous specialist job, and that I recognised I didn't know much about. And so it was really a motivation to learn more about something which I think was both important to patients but also interesting to me academically.
So I actually did some physician training before I did anaesthesia training, and I did a holistic rehabilitation model and got involved with a lot of allied health staff as part of stroke rehabilitation unit, and that certainly influenced me in then wanting to talk to people and look at people holistically. And with anaesthesia I loved procedures, and so those two married well.
One of the biggest problems I find, our patients see lots of doctors before they come to the pain clinic, and what they don't get is some time for someone just to listen. You don't actually have to have all the answers, you just have to listen.
It is approaching a challenge, it is the problem solving that comes with meeting clearly complex patients with ongoing needs. I like the continuity of care involved, and I guess for me personally it's a bit about being part of an interdisciplinary team and working within a department for the greater good.
For patients who feel that often the rest of the medical system hasn't been that useful for them, and I think they appreciate a lengthy and sort of well thought through sort of approach that the pain medicine especially allows you to do.
It means being a physician. It actually takes me back to the reason why I wanted to be a doctor in the first place. And that is that I can really reach out to someone and make a difference to their journey just by listening, by being me, and by allowing them to be themselves. And even that interaction, that moment is enough. Beyond drugs, beyond whatever else is there, but just by holding someone and treating them like a human.